knew, but the second week I actually wasn't here. I was traveling to Costa Rica with the HPA department. So as part of that project, we basically are told to come back and research another topic and then present it to the class to kind of spur some interest in the trip and let you know what opportunities are available for you. So I just wanted to give you a quick rundown of what it really was that I did. It's a 3-credit course that is taught by Celeste Newcomb, and it's pretty much structured like an independent study where we met about 3 times before the trip just to go over some basic information on Costa Rica and their healthcare system. Then we spent a week there touring hospitals, clinics, we got to do some cultural visits, and then when we come back, we basically pick one subject that we want to research more, and then we develop a poster on that and we present that. Well, if you're a senior, you can present it at the mayor's lecture. If not, you can hold on to it to your senior year and present then. It is an additional fee, so your tuition is covered in like regular Penn State tuition, but it did cost, this year was about $2,400 plus airfare. Now, which is very expensive for most of us who are undergrads, but I was able to get a lot of funding through different sources. So for me, I just had to pay for my airfare. So don't let that discourage you. There is a lot of opportunity there.
So wait, let me ask, what did the $2,400 include then?
So then the $2,400 was strictly for the program. So it included, we had our hotels paid for, we had all of our food paid for, all of our cultural visits, so tickets ahead of time. Basically, when we got there, the only stuff we needed money for was if we wanted to buy anything ourselves. So I think I spent like $20 on getting some American food at times. But that was really it.
Do you talk about your living conditions?
Oh yeah, well I can.
Okay.
Have you talked about it? And yeah, that's interesting. And also there is an option to honors option if you are in Shire, you just want to do it for more experience. So basically our itinerary, the first 2 days we stayed in San Jose, and that was their city. So we stayed in a Radisson, very nice, very clean, awesome. There we visited one hospital, which was actually the oldest national hospital in Costa Rica. So that was, really interesting to see. It was very old infrastructure, and they don't really put as much money into developing their infrastructure. So it was kind of run down, just not what you'd expect to see in America at all. And then in San Jose, we did get to see a crafts market and a gold museum as well. So that was some fun things to do. We spent 2 days there. And then we went to Las Cuencas, and there we visited another hospital, which was a lower level, was regional. And then we visited 2 clinics that were local. They're pretty much similar to like a primary care physician's office if you would go here, except they do like dental and some other services as well. They're really made to serve the community. And then we got to have some really cool cultural visits there too, which is what that program fee goes towards. So that there is Costa, which we got to hike and see. We got to see a coffee tour of the plantations, and we got to spend a day at the beach, which was really awesome to kind of get a break from the tours. And there we actually stayed in little shacks, I want to say. You have to be comfortable with the living environments. There was like no hot water. We turned on the sinks and bugs came out. We slept under mosquito nets. So it's definitely a shock going from a Radisson to something like that, but it was 2 nights. It was actually really cool to get to see that kind of change. And then the third place we went to was Monte Verde, very similar. This is kind of like in the rainforest, the jungle area. We visited another clinic there where we got to follow some of the ATAP workers and go out into the community, and I'll talk about what that is later. And then you'll see there we got to do painting bridges in the cloud forest, we got to go zip lining, we did shopping in the city there, and we saw a hummingbird gallery. So it's a good mix of getting to see what their healthcare system is like and also having some fun while you're there. But I wanted to talk about why Costa Rica is so different than our health system. And they really do view healthcare as a universal right, meaning they will provide it to anyone regardless of their ability to pay. It is universalized, so they do pay for it out of a social security tax, but if you can't afford to make that payment, you can still get primary care. And you'll see equity, solidarity, and universality, where they're really their guiding principles, and you'll see those posted up at all the hospitals, all the clinics. They really do abide by those rules. And then that quote there from the Ministry of Health, that's basically like their Department of Health and Human Services for us. But they really do focus, it says health promotion and intelligent social participation, basically meaning promotion and prevention is what they view as how to obtain the best health. So their primary care structure is a lot different than what we have there. They basically have these teams called e-bais, which you can see the translation. I would butcher that if I tried to say it, but it's basically a team of healthcare. And so this is the first person you'd see, kind of like a primary care physician, except it's a team base. They focus on the promotion and the prevention, and there's a little over 1,000 of these teams throughout the country, and they each serve about 3,000 people in the community. So it's a physician, a nurse, a pharmacist, and then an ATAP worker. So what the ATAP worker does is it's a really unique position where they have about a 6-month training in medical technology, but then what they do is they actually go into the community and do home health visits. So they'll come and visit you, they come unannounced, they don't make an appointment, and they have surveys with them. So they'll come into your home and they'll fill out a community needs assessment tracking like your weight, your height, does your living conditions put you at risk for catching things like malaria, dengue fever, what's your socioeconomic status, are you pregnant? So it's this big survey that they do on each person, and then they take it back to the government, and the government then uses that data to prioritize their public health assessment. And you'll see too, they actually rank the houses on a scale of 1 to 3, 1 being the most severe. So if we visited some one houses, they had like no running water, it was, you saw like lizards in the house, it was just completely different than anything you'd see in America. Very, very poor living conditions, and those ATAP workers will typically visit about another 4 times throughout the year just to make sure that if there's anything that comes about, then they can refer them to the local clinic and to provide any vaccination or prevention medicine they can. A 2, they typically come back about 1 or 2 times throughout the year, and then if you're a 3, that means you're pretty good. They'll just return annually to give you your vaccinations because vaccinations are mandatory in Costa Rica. So we talked a lot about how their primary care is a lot more intensive, a lot more individualized than what we have here. And if you look at the outcomes, it's very almost similar to what we have, but they spend nearly $8,000 less per person. So it's really interesting to see they're right around our life expectancy. They even have lower rates of obesity. Tobacco use is a little bit higher, but that's more common over there. You will see that their infant mortality is higher than ours, but if you compare it to the regions around them, it's a lot lower, and that has to do with the fact that they're actually the only country that has safe drinking water there, and they really do emphasize like maternal care. So as far as what they spend on health, because they have this really big push towards prevention and promotion, they are achieving really great outcomes for their region, and that's basically why we went over there to study them, to see what can we take from their primary care and maybe implement back in the US. So then I just included this here, and I can send out the PowerPoint if anyone's interested. Celeste is still taking more students over in May, and she'll be running the program again next year. So there's links there, I can send it out. You can go see the sites, you can see the blogs we did, and if you're interested, definitely reach out to her. She's super nice and is always looking for more people to attend. So that's a little bit about Costa Rica. And the weather was much better than State College weather here at that time. So does anyone have any questions?
Questions for Katie?
Perfect, thank you guys.